Hello and welcome to this special episode of Talk Africa, co-produced with Ethiopia Broadcasting Corporation. I'm Beatrice Marshall from CGTN, and I'm delighted to be here in Addis Ababa to explore one of the most significant health partnerships shaping Africa today.
And I'm Shifa Raulaka from Ethiopian Broadcasting Corporation. Today, we will discuss the collaboration between Africa CDC and China CDC, a partnership that stands as a testament to nearly 6 decades of cooperation in the health sector between China and Africa.
The Africa CDC headquarters is a flagship project announced at the 2018 Beijing Summit of the Forum on China-Africa Cooperation. Now, in just 25 months, the two sides have gone through tremendous challenges and successfully completed the project.
And we'll be joined by an esteemed panel of experts who will delve into the key areas of this collaboration and the impact it has had on Ethiopia and Africa as a whole.
But the conversation does not stop there. We'll also explore how the Africa CDC, with continued support from China, can enhance Africa's capacity to respond to emerging diseases, develop vaccines, and reduce its reliance on imported pharmaceutical products.
And finally, we will look at the future, how this partnership can evolve to strengthen preventive health care, address the continent's ongoing health challenges, and set the stage for the upcoming FOCAC summit in Beijing, where Africa must define its own health priorities.
So stay with us as we embark on this insightful discussion on the future of public health in Africa, right here from the EBC studios in Addis Ababa, Ethiopia. Thank you for joining us for this special discussion on the collaboration between the African CDC and China CDC. We have a lot to discuss, so let's bring in our panel of experts. Joining us today, Professor Francis Chisaka Kasolo, Director and Head of the World Health Organization Liaison Office at the African Union and the UN Economic Commission for Africa. Also joining us, Dr. Abebe, Public Health Expert and Director of MSI Ethiopia. Also joining us here is Dr. Zhang Ji, Senior Advisor at the Africa CDC. Thank you all for joining us on the program.
And in addition to our esteemed panel, we're also joined by a live audience made up of medical professors, doctors, and medical researchers. Their expertise and insights will add depth to our discussion, and we'll be hearing from them at various points during the conversation. Thank you for joining us.
Professor Kasolo, let me start off with you because according to the World Health Organization, healthcare systems in Africa suffer from neglect and underfunding, leading to severe challenges across, and we're talking about across the continent. So what is the actual state of Africa's public health sector? What are the primary diseases that are impacting African health today?
Thank you very much for inviting us to be part of this program. And let me start by saying the health systems on the continent of Africa have indeed made significant stride in terms of improvement and improving health outcomes. For example, we've seen an improvement in the life expectancy on the continent from around 44 years at the start of the Millennium Development Goals to now approximately 55 years. We've also seen a reduction in maternal mortality from over 700 per 100,000 live births to just over 500 mortality per 100,000 live births. This, although seems to be a great improvement, we still are faced with significant challenges. Top among those are one, the low funding, especially domestic funding to support health. Secondly, we also have challenges in the workforce, the health workforce. We may have numbers, for example, of nurses, but we don't have what we'd call nursing specialists that we can call upon for some of these challenges. And in particular, if you look at maternal mortality, the best way to have this is to have a lot of midwives available as near to the population as possible. And if you look at the numbers, most of the countries do not have adequate midwives to attend to the delivery of our mothers. Right. And then, of course, the infrastructure remains quite weak, and most of it is concentrated in the urban setting. Turning to the conditions or diseases that we still continue to face, we still have significant burden of what we call communicable diseases. Examples are, for instance, malaria, the HIV, tuberculosis, vaccine-preventable diseases such as measles. We also are having a growing pandemic or numbers of what we call neglected tropical diseases. For example, the cancers, the respiratory diseases, the heart diseases.
Right. And
we also then now have conditions or situations in our countries that are beginning to drive some of these diseases. For instance, we are moving into what we call the forest to try and explore, for instance, for minerals. And we are now coming into contact with animals who carry different diseases, which are then crossing over to humans. So those are some of the conditions that we continue to face on our continent.
All right, Dr. Shiburu, let me come to you. So which areas of health cooperation between China and Africa do you see as having had big impact on the continent of Africa?
First of all, thank you very much for having me. I'm very much grateful for China's support to the African Health Development Program over the last decades. Africa has been benefited with such kind of strategic partnership between China. So when it comes to the Africa health sector, as you know that particularly over the last 5 years, Africa health sector has been severely challenged by main 3 C's. COVID, as you know, the COVID disrupted most of the health sector system in Africa context. So before, just when at the moment of COVID, as you know that more than 50% of the health facilities are in Africa. They have stopped providing basic health care services, which attributed to increase in the maternal mortality 32% in a year from its status before COVID. So that means still we are in a COVID hangover stage. This is one important thing. The second thing, as you know, that climate change is another important aspect that really undermining the rights and well-being of African women, particularly when it comes to basic health services. The third one is just conflict. Conflicts happening elsewhere in Africa context that also undermining the rights of African not to access basic health services. So these are the 3 main areas that really challenging the African health sector program. So when it comes to the partnership between Africa and China, there are areas which I consider it might have big impacts. So I'm trying to relate with what the WHO 6 pillars in order to provide basic health services. The first one is leadership and governance. This is the most important thing. The second one is health service delivery, and the third one is financing, and the other one is just basic supplies and all those things. So if China able to provide or continue to provide, particularly in healthcare system strengthening, in technology transformation, and providing basic support, particularly that helping the private, the basic healthcare service to private service with adequate financing, that would help Africa to benefit from such kind of partnership.
Right. Yeah. So, Dr. Jang, I want to continue a little bit on that thought by Dr. Abebe in terms of the partnership between China and the collaboration between China and Africa, because the Forum on China and African Cooperation has always provided a forum for China and Africa to cooperate on many issues, and one of that is on the issue of health. Now, in 2018, Chinese President Xi Jinping proposed to work closely with African health sectors. Why is this important?
Okay, thank you for inviting me for this program. And because our President Xi has proposed a concept for the shared future for humankind, and also he raised up the China-Africa health community, and I still remember that during COVID time, when China is going through the hardest time, and the African country is the first who's supporting China. And I remember that over 50 African country leaders has expressed their support to China and sending a lot of anti-epidemic materials to China. I believe that Chinese people will never forget this precious friendship with the African people. So to jointly against the threat of the diseases and also against the politicization of some individual countries, I think to put the medical and health collaboration on top priority, I think it is critical and reasonable. Thank you.
So, Professor, coming to you, as you know, the continent of Africa has huge health burden issues. And in 2001, the countries on the continent of Africa committed themselves through the Abuja Declaration to devote 15% of their annual budget to improving the health sector. So how has this been implemented? And what are some of the challenges that the continent is still facing?
Well, certainly, unfortunately, the well-meant push from our leaders in 2021 has not resulted in real increase in terms of the available health budget. Using the Abuja Declaration, less than 4 countries as of now have actually attained the 15% budget allocation to health. I must also mention that there is now an increasing shift from really looking at the 15% to really looking at the per capita expenditure on health in countries. And the reason for this has been that in some countries, even that 15% is not enough to support health delivery for the population. And therefore, we're looking at a per capita expenditure on health of somewhere around 150 to 200 US dollar per person, as really being able to drive the change that we want to see in health. There are, of course, challenges why this is happening, and my brother on my right had mentioned insecurity. Most of our countries have issues of insecurity, which are leading to reprioritizing their budgets to try and address the insecurity. We also are having natural disasters and climate change, and the mudslides, unfortunately, that we had here in Ethiopia, for example, means that resources that were meant to push the routine health services had to be deviated to address these new health challenges. And of course, there is inherent wastage, that even the little that we have is not really being accounted for on how we are spending it on health. If you look at the distribution of expenditure, much of it goes into either human resource or into procurement. But procurement of certain commodities that may not be addressing the burden of diseases that countries have. So we need to really look at our governance, how we can be more accountable with the little resources while building a larger pool of resources or financial resources to support health delivery.
So I want to come to you, Dr. Abebe, because Professor Kasolo has talked about that 15% of annual budgets of African countries not even being enough to cater for the health sector. From where you sit as a practitioner, what is the constraint exactly?
The constraints. Well, the main constraints, okay, the Africans heads of states already have committed the Abuja Declaration just to allow 50% of their, national budget to the health sector. But as my friend Professor mentioned, less than, 2 or 3 countries are already able to meet that one. So what does it mean? So the constraint would be one of the things are basically the African health programs heavily funded by donors. That might create a kind of, precedence in essence. African countries, they are relying, their healthcare system to be funded by the external donors. So because of that, they have able to divert some, the internal budget that's supposed to be, covering, the health sector to another development program. That's not a problem. But at the meantime, the health sector is suffering. So these are other important things as I've tried to mention. The African Health Program has been challenging over the last 10 years because of different, natural and man-made problems. So that is the main reasons that really constraining, most of African countries not to, to meet that 15%, declaration of commitment. Basically, as I've tried to mention earlier, if you see elsewhere in Africa, there are a number of conflicts taking place that consuming most of the resources that's supposed to go to the health sectors. So what some of the studies conduct is to ensure that more than 60% of maternal mortality coming from those countries who are affected by conflict and natural disasters.
Right.
So this because of these things, I mean, most of African states, they're diverting their budget to the other sectors rather than bringing to this. So this could be one of the constraints which I have seen over the last 10 years. What's happened in Ethiopia and I mean in Africa, particularly why African countries fail to meet that 50% of Abuja Declaration.
Right.
And Dr. Jang, let me come to you. What are some of the mandates of the Africa CDC and how does it work to deliver on its goals and objectives?
Okay, the general mandate for Africa CDC is to safeguarding the Africa health and strengthening the national public health institutions and detect and respond quickly and effectively to the disease threat of disease and other outbreaks. To achieve this mandate, we have set up 6 priorities and 7 enablers. The priorities including the integrated health systems and the robust system for the response and outbreak response and preparedness, and also disease surveillance systems, and expand and strengthen the laboratory network in Africa. And also we mentioned about the innovation research and expand the local manufacturing. Enabler including the the digital health technologies and the strengthening the national public health institutions, and also we just focused on the respectful and action-oriented partnerships. With all these priorities, clearly settled priorities and enablers, I believe that Africa CDC will achieve this mandate in the future. Thank you.
So I want to look at that mandate because if you look at Africa, Professor Kasolo, and going back to the COVID pandemic, Africa was really disadvantaged when it came to vaccines, when it came to being reactive to the disease. So what exactly has changed when it comes to Africa's public health sector now that we have a fully functional Africa CDC?
Thank you. I think one of the important things to note is that the Africa CDC, being a specialized agency of the African Union, is bringing on board what I would call high-level political advocacy for health. Most of the what you call public health players on the continent had mandates that did not drag in or pull in our political leaders in countries. So it's important that now that we have an African CDC that has links with our presidents, the expectation is that we're going to see in the short term, the involvement of our leaders in the discussions on health. But not only discussions, but also investments in health, because this is now going to be a key priority being driven by them through the Africa CDC. Secondly, I think they also bring in an important arm of really trying to coordinate public health across the continent. So we are hoping that in the intermediate phase that the Africa CDC will play a significant role in bringing all health players on the continent around the common agenda. That is to support the member states of the African Union deliver on their health commitments, and then resulting in the long term in the improvement in the health outcomes in our countries on the continent.
Dr. Chang, let me just get your thought on this, working with the Africa CDC. What will be the short term, the medium term, and the long term of having an Africa CDC?
In short term, Africa CDC has already worked out in many areas of public health. For example, the event-based surveillance system in Africa CDC. We have collected the disease data from member states every day, and we analyze it every week and discuss it. And also for in the area of laboratory network, we have set up the laboratory network around the whole continent, and we have conducted a lot of capacity building program in regional coordinator centers and in member states. And in midterm, I think with our mandate, we will just strengthen the national public health institutions, and also we will just strengthen the capacity in member states. And in the long term, with the mandate of strengthening local manufacturing, innovations, research and development, and also including the respectful and action-oriented partnerships, I think we will just have a very bright future in public health development in Africa, in the whole continent.
All right, we're going to get a comment now from members of the audience. Dr. Wondersan, let me come to you here. We've heard about the challenges experienced across the African continent. I want to take an example of Ethiopia. As a practicing medic, what are some of the major challenges you're experiencing?
Yeah, as a practicing physician and a researcher, in Ethiopia being one of the low and middle income countries, most of the cases whom we see are because of infectious diseases. Infectious diseases are directly or indirectly related to poverty. So the kind of people who are heavily stricken or affected with infectious disease, by and large, are from the low socioeconomic status. And infectious diseases happen as an endemic disease like tuberculosis, malaria, often in Ethiopia, and sometimes we see it as an epidemic or as an outbreak, and HIV. You know, these are the three most common infectious diseases. And when we come to the challenge that we do see, you know, the diagnostic challenge, you know, to diagnose, particularly when patients come very sick, you know, to promptly diagnose and initiate treatment, the diagnostic facilities are very limited. And we don't have the access to point-of-care testers, you know, with very high sensitivity and specificity to diagnose very common diseases like malaria does. And these are the ones which do kill people. And the availability of potent, safe drugs with proven, you know, efficacy, quality, is also another challenge. So there are a number of challenges, and these are people who are malnourished or coming from, because they have the low socioeconomic status. There are a number of factors directly or indirectly affecting the outcome of the disease. So in general, the most common problems are because of infectious diseases, and the most common challenge that we do see encounter are diagnostic and treatment, you know, or lack of the right diagnostic and right treatment choices.
Right, Dr. Akililu?
Yeah, thank you. As noted, communicable diseases are communicable diseases are important issues in our country. But in addition to that, we say low and middle income countries and also Ethiopia are affected by triple burden of diseases. Therefore, now there is a rise in non-communicable diseases as well, cardiovascular problems, pulmonary problems, cancer is also on the rise, mental health problems are also increasing. And in addition to that, the other pillar of problem is injury and emergency related problems. From the forum, it was the panel forum, conflict was mentioned now and then. Really, you know, day-to-day injuries, conflict-related injuries, and the disaster which is related to climatic change, ecological change, and so on, is really a very common phenomena. Some few years ago, there was a data done by Ministry of Health, that is the National Health Act survey, and 60% of mortality was assumed to be due to injury and emergency-related issues. Therefore, these are important issues in our country. When it comes to the healthcare system, you know, the capacity is really a very important issue. The laboratories, the equipment, most of the things are really imported. And that is really to be underscored. And when equipment fail, maintenance is a problem. When reagents are not just available, then bringing them is really just a problem. Vaccine, whatever you said. Really, locally developing this thing is also an important issue to be seen in the future. And funding is also mentioned, and then that is a very crucial issue. You know, the government funding only is not enough. Most of the time, people are really paying from their pocket. Poor people with communicable, non-communicable diseases, injury, then they are going to really poverty. Therefore, injuries, emergencies, communicable diseases are taking a lot of people in developing country again to poverty line or below poverty line. Therefore, you know, health financing system is really a problem. And when we come to health service delivery also, we are not really having, you know, just evidence-based practice, guidelines, standards, and so on. Therefore, that is one important area. Maybe last issue on human resource. You know, many of our issues are not really included in the pre-service education. One is really disaster concept. Disaster concept. Therefore, these are really important issues. We have to really remember the HR, not only the numbers, the quality, the mix, and also the, you know, capacity of HR is also a problem. Thank you.
Okay, coming to Dr. Garamo. COVID-19, as you know, sir, found Africa with weak health infrastructure and exposed global inequalities. And one of the priority areas and mandates of the Africa CDC is to ensure robust emergency preparedness and response capabilities of, for all public health emergencies. So would Africa find itself in a similar situation if other health complications and health outbreaks occurred?
My name is Garamo Tasso. I'm from Ethiopian Public Health Institute. Yes, it is. Previously, COVID-19 has given us a huge lesson to Africa, particularly to Ethiopia. When the pandemic broke out, Ethiopia was not in a position to detect the infection, so that we are supposed to send to abroad, like in Kenya or to South Africa. However, within a very short period of time, thanks to Africa CDC and also China CDC, and of course to the Federal Ministry of Health and our colleagues from different universities, we try to cope up to detect the COVID-19 at home. And we established from the scratch the laboratories, and we try to manage to establish over 80, around over 85 laboratories across the country, and we provide also training. Well, the problem that we had previously was that we know how to detect it, but we do not have resources to bring to make it for the detection. We previously used the technique for the academic purpose. Now, learning from that, we try to write a grant from granting organizations such as EDCTP, European and the developing countries partnership. We try to capacitate to detect and preparing our service now to the level that we try to detect the organism up to the genomic level now. At Ethiopian Public Health Institute, we established now to detect the COVID-19 and beyond. If X pandemic comes, we have as the position to detect it. The problem pertaining to this facility is only, as my colleagues explained, is lack of necessary reagent, capacity building, and giving some training. This is due to even not only that, keeping or maintaining our professionals, or Ethiopia, not only Ethiopia, maybe Africa also faces the brain drainage. When we trained people up to postdoctoral level, they flew to other developing countries. This is the main challenge we have, and there's also we do not have necessary reagent or equipment vendor in the country or in East Africa that we easily get access to it. These are the main challenge. Unless otherwise, we have also already have an infrastructure. We inaugurated it now with the collaboration with Africa CDC and other key partners. We have the capacity to do it, but we need further capacity to work with Africa CDC and also China CDC to enhance our capacity to work on, particularly to play our role in East Africa when APHI is concerned.
So, Professor Kasolo, you've heard that COVID-19 was a huge lesson, not only for Ethiopia, but also for the African continent. Let us look at where we are today as a continent in terms of preparedness. What is the state of the continent's state of preparedness today, giving as an example the current outbreak of monkeypox?
Well, thanks. I think one of the things that we ought to know is that preparedness is linked closely to what we call health systems strengthening. Because a system that is strong and is talking to each other across the different levels of governance will be able to respond to the different outbreaks such as COVID-19. But secondly, that working with the Africa CDC and partners, that WHO and indeed other partners have been working with countries to really reflect on where we got things right and where we had challenges during the COVID. And in so doing, of course, hoping that the governments and those that are working in global health can invest not only resources, but also things like technology and innovations in strengthening systems. So there is a continuous process of monitoring what is going on in terms of preparedness. And I must add here that it may seem that the investment that has come from COVID has gone a long way in really having most of our countries prepared to respond to the next pandemic. Yes, we need to improve on it, but I think the foundation has been laid with the investment that came during the COVID pandemic.
Let's also talk about some of the countries that were instrumental and exemplary in accomplishments. Take, for instance, China. China in 2021 managed to eradicate malaria. So how did it manage to do so? And what lessons can Africa and other countries draw from China?
Okay, the elimination of malaria in China had been over through 70 years and generally in 5 periods. Briefly describe the experience, I can put it into 5 parts. First is the strong leadership of the government, and the second is cross-sectoral collaboration. And the third is the innovation and research. The fourth is the comprehensive participation of the whole society. And the fifth is rely on the traditional medicine. Strong leadership means that the China government takes fully responsibility for the elimination of malaria program, and he just pushed forward the whole program in different sectors, and the different sectors, they will work together to just to facilitate all this financial problem and the research problem and the innovation problem, and also during this time, the Ministry of Science in China has released a lot of grants and funds for the innovation and the research. I remember that we have a lot of great innovation for malaria. for example, the long-term mosquito net and the diagnostics, and also the very famous 137 work model, which means that report within 1 day after diagnosis and case treatment and tracing within 3 days, and report of the whole outbreak and treatment within 7 days. And also, I think the China government has conducted a lot of advocating and training in and reached out to every corner of the epidemic areas. And every Chinese people understand the policy of malaria elimination and support the government. And the last one, I think, is the traditional medicine. And the China government is just seeking the solutions to the malaria elimination. And the very famous medicine, artemisinin, in China we call it Qinghao Su. And I remember that not only benefits Chinese people, but also saving millions of lives in Africa. So you can see that this is only a very brief introduction. And I believe that with the collaboration, health collaboration between Africa and China, we can just sharing and exchange our opinions and experience.
We've heard from members of the audience and from yourselves that Africa still has a huge, disease burden. So how can African public systems become more resilient? What do we need to do to better prepare for and respond to the outbreaks of the infectious diseases that we are talking about here?
Great, thank you very much. I think what needs to be done, particularly in order to ensure the Africa health system's resilience, provided that still a number of challenges that Africa is facing. Apart from the infectious disease, okay, the infectious disease has been mentioned, but the most important for me, for example, from the public health perspective, for example, Africa is the youngest population continent, and then of course, maternal mortality, for example, one of the major concern in Africa context, and then it's reduced significantly, but still there is a huge number of women are dying because of different reasons, particularly lack of services, apart from the infectious disease problem that they are facing. And the other thing, yes, teenage pregnancy, also another major concern that we shouldn't undermine. More than 60% of the African population are young people, and more than 50% of women, and young people and then girls. So the teenage pregnancy is a cause of concern for us, for Africa. It's up to 48%. It is unacceptable by any standard, having an African woman, facing such kind of problem. So in order to improve such kind of situation, in order to make sure that African health system is resilient, the first important thing is, strengthening the leadership and governance system. Because the main challenge that Africa has been facing is one thing, the leadership, and the second was lack of, trained personnel, and the third one is, just financing. Still, if we want to make Africa health system resilient, we have to make sure that we have very strong advocacy to bring a very strong leadership and governance system in place. And the second one is just we have to build the capacity of providers. The third one is domestic financing is crucial. The future is uncertain. If Africans still rely its resources for health sector from abroad, from donors, it might not work. It might not going to be a comparative advantage. It had been a comparative advantage before, but not more comparative advantage as we are looking at what's happening in the future. So that means in the African nation, they have to build a strong system, particularly in domestic financing, and at the same time, there should be a mechanism to manufacture, local manufacturing, some of the medicines, some of the items that are required to address the major infectious disease that's happening in this country. These are the three areas: governance, leadership, providers capacity building, and domestic finance as the three critical areas that are considered as a pillar if we want to see the future of Africa that we want.
I want to come to the Forum for China-Africa Cooperation. And I want to get your input from our members of the panel here, because the theme of FOCAC this year is joining hands to advance modernization and build a high-level China-Africa community with a shared future. And I'll start off with you, Dr. Chang. What is your interpretation of building a health community for all?
Okay, for me, the China-Africa shared community of health, I think the firstly means solidarity. I think we need to jointly to to deal with the threat of different epidemics. And during this period, I think, firstly, I think we need to, against the politicization, labeling, and stigmatization, and using the advantages of each side, and collaborated in different areas, just as mentioned, our guests have mentioned in the different areas. That is, thank you.
Right, as we come to the end, Dr. Abebe, your thoughts?
Yeah, I think for me, the most important thing for me is just a partnership between Africa and, there are a lot of partnerships taking place, which I'm very, very grateful for that. But when it comes to the health sector, the partnership has to be strengthening. And the second one is not just technology is a critical part, because technology is a second wind of transformation for a nation. So as we are living in the 21st century, technology is the critical part. So China is ahead of us, ahead of many countries in the world. So we want to take advantage of this technology transformation, skill transformation through this strong value-added partnership. So I think this could be the areas which I'm considering. How can we strengthen the Africa-China partnership?
Professor Kasolo.
Thank you again, and I think I totally agree with my colleagues on the panel. But to also say, one of the weaknesses in talking about the health community has been the sharing of knowledge and experience. We heard a few minutes ago on how China has eliminated malaria. If that knowledge and experience can be shared with the African countries on how they did it, we will probably be moving in a coordinated manner within the continent, but also with our partner, China. Secondly, that this should not just be stopping at the national or central level, that this health community should extend to the real community, which is the people. And so encouraging people-to-people interaction with those that have driven health in China to the levels that we now see. For example, bringing them to work with our small health facilities, exchanging knowledge at that level, working with our community health workers to try and improve their understanding of what they can do better within their sphere. For me, that will then lead to an integrated health community which looks outside but also looks inside to improve health and outcomes of our people.
Well, a very insightful discussion indeed. But that's all we have time for on this special edition of Talk Africa. A big thank you to our panel of experts. Professor Francis Chisaka Kasolo, Director and Head of the World Health Organization Liaison Office at the African Union and the UN Economic Commission for Africa. Dr. Abebe, Public Health Expert and Director of MSI Ethiopia, and Dr. Chang Yi, Senior Advisor at the Africa CDC. We would also like to thank our live audience. Thank you all for joining us and for your contributions. Remember, you can be a part of this conversation through our social media platforms on Facebook and X. And you can watch this and other editions of Talk Africa on our YouTube playlist. Do join us again next week for more Talk Africa. From me, Beatrice Marshall from CGTN, it's goodbye.
And this has been a co-production between CGTN and Ethiopian Broadcasting Corporation. Let us know your thoughts on this topic, and we'll see you again. I'm Shifara Olaga with EBC. It's a goodbye for now.